Hey folks, I'm Barry Hilton, and I've got to tell you something serious for a change. Now, lockdown has made us focus on respiratory illnesses, and we are doing our best to avoid contracting or spreading COVID-19. If we don't, we might just get next year's model, COVID-20. We should take some quality time to spend with our bodies. Personally, I spend 8 hours a night with mine. Moles, lumps, and bumps. South African summers are for braais, swimming, sport, and many other fun outdoor activities. But the downside of the sun exposure is the long-term, lifelong risk for the development of skin cancer. Sadly, I lost my mum and my brother to cancer, so this is always top of mind for me. Skin cancers fall into two broad categories: melanoma and non-melanoma skin cancer. Melanoma, if diagnosed late, can be fatal. But if detected early, surgery can be curative. Just one bad sunburn with peeling and blistering is enough to increase your lifetime risk for the development of melanoma, which of course can arise in existing moles or new ones. This type of skin cancer can develop anywhere on your body, and I mean anywhere, even on the soles of your feet or the palm of your hands and nails, but mostly on sun-exposed areas like the face, arms, neck, chest, and back. An easy way, we all like the Big Easy, except he's not playing golf too well at the moment. So an easy way to remember how to keep an eye on moles is to use the ABCDE system. A, asymmetrical mole. B, irregular border. C, changes in color, dark or black segments. D, diameter greater than 6 millimeters. Evolution, any change occurring in a mole or a new lesion arising. Let's be diligent and check regularly. We don't want to end up with a whole alphabet. The most important thing to remember is evolution, unless of course you are a creationist. Any new moles arising, moles changing size or color, or becoming itchy should be checked out. And don't wait. As they say, just do it. Non-melanoma skin cancer, typically shortened to BCC and SCC, but there are others too, typically don't look like moles. Ferrets and rabbits are excluded. They appear as raised red crusty spots anywhere on sun-exposed areas. Common areas for skin cancer to occur include your luscious lips and eavesdropping ears. Any spot that itches, forms a scab, doesn't seem to want to heal, feels rough, or bleeds should be evaluated. If you notice any skin areas that bother you, see your GP, dermatologist, or plastic surgeon. Make sure you choose a plastic surgeon who accepts plastic as a payment. Breast cancer. October is Breast Cancer Awareness Month. But why wait until October? Get your partner to check your breasts every day. Who knows, it might be a lot of fun. Breast awareness should be a year long, since breast cancer is the most common cancer amongst women worldwide and only affects 1% of men. Again, be alert. Early detection saves lives. Early stage breast cancer has a 90% cure rate. We should all be checking our bits regularly. Now, it's not your job to diagnose a breast lump, but it is your responsibility to get to know your own breasts. Introduce them to your hands. That's probably why most men are always touching their test tickets. Know the shape of the breast, the direction of the nipples, and the feel of your breast tissue. Signs to look for include a palpable mass, nipple discharge, nipple retraction, and often just a change in how your breast feels to you. It's also a good idea to have an annual clinical breast exam, either with a breast screening clinic, your gynae, GP, or a surgeon. I'd offer to do it, but you'd have to see a professional, and my wife would probably kill me. Officially, women over 40 should have annual mammograms, but sometimes it needs to start earlier. Now, women are often scared that a mammogram is painful, but with the latest technology, digital mammography is not painful. maybe just a bit uncomfortable. And all things considered, a few minutes of discomfort pales in comparison to the months of suffering, and worse when the cancer has advanced. Sometimes women are concerned about radiation exposure during mammograms and therefore avoid having them done. But the standard digital mammogram gives you the same amount of radiation as standing in front of your microwave for 30 seconds. It's about the same time your partner takes to prepare your luscious, beautiful, well-deserved meal from a box in the microwave. Now, men usually don't get mammograms, but a breast ultrasound is done to look at suspicious lumps. I'm sure most gents would gladly ask their partners to have a close look at all their parts. People are staying home during lockdown, and many are not going to the doctor to have their chronic diseases monitored, get new symptoms checked out, or getting screened for cancer. But we must remember, COVID doesn't prevent cancer, high blood pressure, or gallstones. So don't ignore new symptoms. Remember, your doctor also doesn't want to get COVID. So medical practices are implementing mechanisms to keep you as safe as possible. In fact, it's a legal obligation to screen everyone entering the practice for signs of COVID. Medical practices are disinfecting between patients, so please be a little patient if you have to wait a little bit longer for your doctor so you can be a patient. Make sure your doctor's practice screens everyone coming in, checks temperatures, wears appropriate PPE, enforces social distancing, wears masks, sanitizes, and washes hands. Come on, people. It's important. So important, it could be life-saving. Take the plunge. Get that niggle checked out. Be safe.